Welcome to the Cystic Fibrosis Foundation Virtual CF Education Day, Partnering for Care, CF Foundation Accredited Care Centers. I'm Leslie Hazel, Director of Patient Resources at the Cystic Fibrosis Foundation. This webcast is hosted by the Johns Hopkins Cystic Fibrosis Center and supported through an unrestricted educational grant from Genentech. It is part of the Partnering for Care series that focuses on the different roles of the healthcare professionals in CF centers that will help and partner with you so you or your child with CF can thrive. Anyone with CF or anyone who cares for someone with cystic fibrosis knows that it takes a team effort. This team includes the person with CF, their family, their friends, and the healthcare providers at the CF Care Center. Partnership is when one person or person takes part in an activity with others. In this case, it's CF Care. Partnering with your healthcare provider at your CF center is important in order to help the person with CF thrive and learn how to fit CF Care into their life versus their life into CF Care. This presentation will discuss what a CF Foundation accredited care center is and highlight partnerships for care. Questions from this segment came from you. Questions not related to the topic will not be asked or answered. For additional questions, please ask your CF Foundation Accredited Care Center, or you can call the Cystic Fibrosis Foundation at 800-FIGHT-CF or info@cff.org. Joining me is Dr. Peter Moygazel, who is the current chair of the Cystic Fibrosis Foundation Center Committee. Welcome, Peter.
Thank you.
So my first question is, what does it mean to be a CF Foundation Care Center, and what is the Center Committee?
The Center Committee is the organization at the Cystic Fibrosis Foundation that accredits care centers throughout the United States. It's comprised of physicians, center directors, and adult program directors, and it is responsible for setting standards for care and for assuring that all CF centers meet those standards.
So then what are the standards, what are the basic requirements for accreditation?
The basic requirements are to have a multidisciplinary team that's comprised of expert caregivers. There have to be at least 50 patients with cystic fibrosis cared for at the center. Age-appropriate outpatient and inpatient care has to be available at the center. And specialists that can provide care to patients with cystic fibrosis must be available for both children and adults.
I'm sorry, go ahead.
There are also guidelines related to diagnosis and care that have to be followed, and centers need to be involved in both teaching and research.
So you mentioned the multidisciplinary team members. Who are on that team?
Typically, there's a center or program director that's a physician, a program or clinic coordinator that's typically a nurse or a nurse practitioner. There are other nurses involved in CF care, as well as a dietitian, a social worker, any other respiratory or physical therapist.
So if a person is having problems working with the team members at their center, do you have any suggestions or tips as to how they can try and correct that and make things better?
Typically, the best thing to do is to talk to the members involved, to talk to the center director, to talk to the physician, to talk to the actual people that are that you're not connecting with the way they would like. A center is made up of individuals, and sometimes goals are not always clear, and I think it's important for patients and families to talk to the care providers to make their goals understood and make sure that everyone is working towards the same end.
So that's some good information. Somebody wrote in and they said that they go to a CF clinic, but it's not accredited. Is that important? Why is that center not accredited, and why should somebody go to an accredited center?
Well, we encourage that all CF patients go to an accredited center. There are a number of reasons why centers are not accredited, but when you go to an accredited CF center that the CF Foundation has recognized as giving expert care, you can be assured that the physicians and other staff there have expertise in caring for both children and adults with CF. And you can be assured that the CF Foundation is monitoring the care at the center and that the center is involved in quality improvement to lead to better care and better outcomes.
One question somebody wrote in is they wanted to know why aren't there centers in some states? For example, Montana doesn't have a care center. Why not?
That's related to the number of people that are in the state or in the geographic region. Care centers are typically located in larger cities where there's more people and therefore more patients with cystic fibrosis, and also where there's more expertise by the care providers. The center network has a way of reaching out to patients that are in smaller venues through affiliate centers, which may not have all the members of the full care center, but have expertise in physicians and other members of the multidisciplinary team. And some centers do outreach, where they will go with a doctor and team members and have clinics in cities or in states that don't have a large number of cystic fibrosis patients.
So another question that came in is, how often are accredited care centers reviewed by the center committee?
The center committee does site visits where members of the committee actually go and visit the centers every 5 years. In addition, each center needs to have an annual report which is filed with the center committee and is reviewed on a yearly basis.
So if there is a person who wants to get involved in this, you mentioned a site visit or the annual review, what can a parent or a person with CF do to get involved in that center review process?
Well, the best thing is to talk to the center director or the staff. The foundation encourages parent and family participation and patient participation in the care center. And it's part of the mission of the care network to try to incorporate patients and families into care. The quality improvement programs that are in place in most care centers allow for patients and families to become involved in care.
So another question related to your affiliate program statements. Do affiliate programs get reviewed, and what's the process for that?
Affiliate programs are reviewed by the center that they're affiliated with on a 5-year schedule, along with the site visit that is done for the entire center. In addition, the larger affiliates have to provide their own annual reports to the center committee.
So there is kind of the same framework for follow-up for an affiliate program as for a main care center, is that correct?
Yes.
Okay. So how are care centers funded?
Care centers receive funding through a number of mechanisms. They receive a grant from the Cystic Fibrosis Foundation each year, which is dependent on the number of patients that are seen there. This grant pays for infrastructure, but only a portion of the care center costs. The other funding that they receive is from the hospital, from research grants, and from the charges that they charge for patient care.
Okay, a question that I get a lot, and that is, why does someone have to change from their pediatric clinic to an adult clinic when they get older?
Sure, that's a question we get frequently. The goal is to have age-appropriate care so that patients are cared for by specialists and physicians and team members that have an expertise in caring for children or adults. So as children grow up and become adults, they need to transition to caregivers that really have an expertise in taking care of adults and not taking care of children. This is kind of a group of questions, and that is, people who are at a care center, can they move to any care center? Are they restricted where they can go to? What's that set up for? Patients can go to any care center they would like. The problem is that you need to be close enough to a care center that you're getting care on a regular basis. And I always recommend that you go to the local care center that allows you to be seen frequently, that allows you to be seen when you're sick, allows you to go for routine care. If there are multiple centers in a region that are close by, then you can go to different centers to see which one meshes best with your philosophy and which group has goals and an approach that's similar to what you would like to take. However, consistency of care is very important. So once you establish with the center, then you should really stick with that center.
Well, that's really good information because that helps the people at the center to know the person with CF better and to really create that full team between the healthcare provider, the patient, and the family. Couple of questions. You mentioned quality improvement a little earlier. So to what extent do care centers share that information? What can someone do if all of their centers are below the national average as reported on the Foundation's website? What can they do to kind of improve care locally?
All the care centers are part of a network, so they do share information. We all get reports on the quality of care, in other words, the outcomes, and the measures that we use include nutritional outcomes and lung function measures. And we also are able to discuss with other centers through collaboratives that have been set up by the Foundation for formal quality improvement projects, but also through listservs and other electronic-based forms so that we can share information between centers about best practices. For patients or families that are interested in improving outcomes, really the best place to start is with the center director or your physician and talk to them about what avenues may be available within the center to help improve center care. Because again, the goal is to have everyone get the best possible care at the center. So
last question, well, any last tips for a family member, a friend, a person with CF, a significant other, that will help them build the partnership with their accredited care center?
Well, I think the key thing is really understanding what the goals are for care and to be on the same page with your care provider. So other family members that may want to be involved or friends should really make an effort to find out what the goals of care are, what the outcome is that you're searching for, whether that be a short-term goal of gaining more weight or a long-term goal of a larger proportion. And I think that having everyone understand what the goals are is really the key thing, and discussing with your doctor and other team members to make sure that you all have that same plan as how to get to that goal is important.
Well, thank you very much, Peter. I want to encourage you to partner with your CF Care Center and to be a full team member, because that will help you improve your or your child's care as well as improve the care that you receive at the care center. You can learn more about being a CF Foundation accredited care center from your care center as well as on the CF Foundation website. You can look under the quick links, the Care Center Network. There's also information under the Living with Cystic Fibrosis and Treatment sections. Under the Care Center Network quick link, you can actually look at care center specific data, the patient registry report, or find another care center that is geographically near you. You can also read about the different CF care guidelines that were mentioned earlier that were a part of being a CF Foundation accredited care centers. These are on the Foundation's website under treatments. However, not all of these guidelines are available publicly. This is due to copyright restrictions from the medical journals in which they were published. When the documents become available at no cost, these will be posted on the CF Foundation website. This webcast is a part of the Partnering for Care series, where you can listen and learn more about how to care for the child with cystic fibrosis as an adult with CF, how to partner with your care center in transition into adult CF care, when you're thinking about a lung transplantation. Also, how to work with your CF nurse, your dietitian, your respiratory or physical therapist, your social worker, your psychologist, in order to help you or your child with CF thrive. I also want to encourage you to watch an archived webcast on the CF Foundation's website. Read about research, hear about research, lung health, nutrition, germs, and more. This concludes our webcast on CF Foundation accredited care centers. I want to thank you for watching and submitting your questions, Dr. Peter Moygazel, who's the chair of the Center Committee for answering those questions, Rick Vasta and the technical crew, Emily Ann Powell, Melissa Chin and the CF Foundation, and Genentech for their unrestricted educational grant. All of you made this webcast possible. Thank you.